Okay, so Dr. Bakr, so he's actually coming from a very long trip.
Yes.
Sure.
Good
Well,
travel.
much appreciated, but this is also one of his passion. He's always looking to learn more how the others doing different experience and to bring this back home to Egypt and to help and support the patients that he has in his clinic. So Dr. Bakr is actually one of the leaders in the plastic and the reconstructive plastic surgery in Egypt and in the Middle East. He has patients not only from Egypt, but also from around the Middle East area, especially Saudi Arabia, Dubai, Qatar, all around, and an international expert and the panels in different events as he joined us today. He is also a member of the Egyptian Society of the Plastic Surgery with more than 12 years of experience, intensive experience, into bringing unique blend of excellence and surgical innovation and more patient-centered approach. He does something similar to the multidisciplinary approach also in his clinic, but I leave it to him to share it with us. So now I leave the mic to Dr. Bakr.
Hello, everybody. I want to show you in this talk how we do the surgery in Egypt, what is our protocol for the pre and surgery and post-operative care. This is our agenda. The pre-operative assessment during the clinic consultation and doing the labs and scanning, we should answer 3 questions. The first one, is it pure lipedema or it is combined with another medical conditions, mainly lymphedema, varicose veins, or obesity? The second one, we can do all the operation in one session or the surgery can be done over different sessions.
The same issue again. It's funny. All right. We got the comments from Mahmoud and that's the technical issue is still going on. Not sharing this. Yep.
Outsourcing. Can I continue? Okay.
Yeah, sorry.
Yes, we can do very well.
There will be as a this skin and the surgery, there will be another surgery to do lifting for this skin or not. After answering these 3 questions, everything should be discussed with the patient, and then we can go for the management. But before management, let us mention that lipedema is a chronic progressive adipose tissue disorder, which can be treated through 2 pathways. The first pathway is a conservative pathway by massage, wrapping, and dieting and exercises. But if it is not effective, mainly with the high stages of lipedema, we can go for surgery. So this is the answers of our 3 questions. And at the end, we have goals from the surgery. The first one is to reduce heaviness and pain and mobility, and so increase the quality of life. And second is to restore body proportion and so self-confidence. For anesthesia, I prefer for the lower part of the body to use spinal anesthesia or general anesthesia according to the preference of the patient, and they may combine together to control the post-operative pain. But if we do surgery for arms, of course, it is mainly general anesthesia, and for some selected cases, we can choose local anesthesia. For surgery itself, I depend mainly on power-assisted liposuction using vibrating cannulas, of course, after injection of tumescent. But at the end of the surgery, I do some refinement and sculpturing using the mechanical liposuction, the regular liposuction, because we have in regular liposuction different varieties of cannulas which can easily to apply and so can do refinement and sculpturing. This some photos of different types of cannulas. Okay, this is the clinical benefits advantage of protocol with late stages of lipedema. First, pain and pressure reduction. Of course, improve mobility and decrease the heaviness. Of course, and the more psychological benefits from getting more self-confidence and reduce the depression which we face with most of lipedema cases, and at the end, preservation of lymphatics through doing lymphatic-sparing liposuction. Some tips and tricks we use, of course, blunt multi-hole cannulas, keep the blood loss under 30 ml per session, adhere to the maximum cell safe volume, as Dr. Fabio mentioned, about 8 to 10% from the body weight is highly safe. Of course, avoid any temperature monitoring and temperature producing techniques. And at the end, avoid the high major lymphatic pathways. So take care and be cautious during liposuction of the medial. For some complication, it can happen after surgery, minor complication like bruising, swelling, and formation of seroma, some temporary disturbance of the nerve sensation. Rare complication I have never faced, lymphatic drainage and produce some degree of lymphedema. And there are some ways to prevent all these complications, like using gentle cannula pathway, layer by layer fat removal, and of course the skill of the surgeon and the best of the post-operative care, which is very important to get the best result for the case. Now we come to the post-operative care. First is, and the most important, is the lymphatic drainage massage. For my protocol, I bend on 4 to 6 weeks of continuous massage. At the first week, to be done daily, 1 session every day, and then 3 sessions a week for the rest of the period. And by the end of this period, I give something like discussion with my physiotherapist to see if the case needs more sessions or we will stop. Of course, there is no massage without combination with the compression guard. And for the protocol of post-operative cases, I use first month continuous compression garment, and by the beginning of the next month after surgery, start to reduce the number of hours of wearing the compression garment. By the end of the second month, we can get rid of the compression garment totally, or we continue for some occasion, like during doing high activity or exercise. Diet. At the first days post-operatively, I ask the patient to depend on high protein diet. High protein diet is very good in healing, so they can depend on it, and also drink a lot of fluids, because they lost a large amount of fluids, mainly during the first week. But later on, of course, the patient should change her lifestyle and stick to the anti-inflammatory diet, any type of low-carb diet according to her compliance. And this will be lifestyle. This should be a commitment from the patient to follow this diet for life. Also, exercising has an important role in the post-operative care for the patient. In my protocol, I start the exercising by the beginning of the second week, the second month, and start first with some rehabilitating exercises using stretching exercises, squat. But after 2 weeks of this rehabilitating, we can add more heavy exercises. I prefer resistant exercises because it gives me the best results, but if it is not available for the patient, she can do any type of HIIT exercise. Okay, this first case was a female, 43 years old, stage 3 lipedema at her lower leg. And in one session with power-assisted liposuction, we remove 6 liters of fat. And this is the photo of post 6 months after surgery. We can see the results. For this photo, we have a patient with 37 years old, second degree, second stage lipedema, both her thighs and her legs. We removed 40 liters, but on 2 sessions with 4 months interval. And this, the post-operative follow-up photo after 12 months of her surgery. This also some of our works. Summary for my talk: lipedema, of course, must be addressed surgical in advanced stage. I don't think that advanced stage can get benefits from the conservative treatment only. In my technique, I use power-assisted liposuction because I see it is highly safe and can achieve aesthetic results. Post-operative care is critical for long-term and sustainable results. And of course, every patient with lipedema mostly need psychological support. Thank you.
Excellent.
Khaled, can you please also display the third poll question?
Okay, the third poll question, which is very important, is how long should compression therapy ideally continue after liposuction in advanced lipedema cases with venous insufficiency? Single choice, so you cannot select all. Number one, A is 1 to 2 weeks, B 3 to 4 weeks, C 6 to 8 weeks, D at least 3 months, then reassess. E, compression is not mandatory post-op. So again, very interesting because we all know compression play a major role in management, especially post-operative management of the success. So a high quality of compression will improve your result. Eagerly to wait, I would think probably they will take selection of D, which is 3 months, and then reassess. This is what I usually do, but I will learn from what the most candid attendee will do and what is the most common practice, and eagerly to see the results.
We are waiting for the result. Dr. Bakr also can give us his opinion in this question. If you have a patient with venous insufficiency in such cases after the post-liposuction with advanced case, what would you recommend?
Go with D also at least 3 months ago, and then reassess if she need more amount.
Yep.
Yes.
Exactly. I think the audience agree with you. 80% choose the same option. There are 4% more if they said compression is not mandatory post-operative, because in most of the guidelines and most of the protocols, people always apply the compression at least to make sure the residual of the fluids are moved out. And but this is also how it shows the level of knowledge and experience are different really from country to another.
Yes.
But do we have any question from the attendees, Dr. Omar?
Yes. We have one question from Dr. Simon. What are the early signs that lymphedema might be returning, and what steps can I take right away to prevent the condition from progressing again? This is to Professor Bakr.
Lymphedema?
I think you meant lipedema, maybe in misspelling.
Lipedema, yes.
Okay, once lipedema happen, it will not return. So, of course, there will be the first sign I will see is the change in shape. Before experiencing any other symptoms like pain, like edema, the first thing is the patient notes a change in her shape of the shape of her legs. But once it happens, she should start some degrees of the conservative therapy, depending at the first stage on exercising and dieting, to avoid the progression of the surgery for more stages. But we can't treat it totally as it happened.
Excellent. And I have a question of mine that I would like to ask Professor Bakr after such a great lecture. Do you think artificial intelligence and robotic arm will play a role in lipedema management? We have all seen new machines which are offering a liposuction robotic catheter to use. And the same question also to Professor Fabio. Do you think that in 5 to 10 years' time, practice will change? I would be interested to know your result because you are on the peak of management of such difficult cases. Professor Bakr.
Well, I think the AI will take the upper hand in the diagnosis. But For the surgery itself, it needs a human. I don't think that the AI will need, it may help to assess the sickness and assess the areas after the surgery or even intraoperative, but without the human surgeon, the AI will not do anything.
Yeah.
Okay,
Yeah.
and Professor Fabio?
Yeah, because maybe the IA may help us to analyze the data. We are using a big data analysis in order just to develop this compression stock. So maybe the analyzing the data is very interesting. Yes, with AI. But still, especially liposuction is a very artistic procedure. It's not so standardized.
No,
So
every case is different.
yeah, so it's difficult for a robot to judge during the surgery what to do. That's the point. Maybe a more standardized surgery is possible to use a robot to do it, but especially liposuction is very artistic still. So I'm not sure that the robot will be able to do it.
It needs out of hand skills to see where to put and what kind of camera to choose and all of that things. It's really, as you mentioned, the tricks and tips. This is really
Also, there are many decisions taken intraoperative. The AI is follow the steps, fix the steps. You cannot change your decision intraoperative. You will not. It will not do this.
Yeah, you know, with the AI nowadays, things can get really, they can really
It would be
proactive. Yes, agree. Actually, I have attended one of the vascular surgery with robotics, with some AIs. But I fully agree with you. Still, you need someone behind. You can't trust the machine just to.
The plastic set.
Yes.
I think if some surgeon do stick to me, or appendectomy even, or something with fixed steps, AI can help, but not for us.
Good.
Okay,
Very
thank you very
interesting
much. It was
discussion.
fascinating. Back to you, Dr. Mahmoud.
Thanks so much, Dr. Bakr. Now, as we are started the journey with the multidisciplinary approach, looking at the vascular assessment, now we get to know more from the different experience, best experience in Brazil and best experience from Egypt. So now we come to the most important role, post-operative, because we also believe, or myself believe, it's 50% of the outcome of the surgery. If you got the most skillful surgeon to do the surgery without the really skilled physiotherapist or lipedema therapist to take care of your patient, this really can really turn everything back to the point zero.